if you can effectively treat anxiety and depression, that very substantially reduces your other costs of physical healthcare. So around about 40% of people with anxiety and depression also have a long-term physical health problem, whether it's cardiovascular disease, obstructive pulmonary disease, asthma, diabetes. And the cost of managing those physical conditions is about 50% more on average if you have anxiety and depression. We can largely remove that excess cost by treating the anxiety and depression. And we've got quite a lot of good data on that. That's sort of reducing your current costs for other healthcare. Some really exciting data recently has also shown that we can reduce your future healthcare costs as a provider. So there's a beautiful article just recently appeared in the European Journal of Cardiology, which followed people up who are treated in NHS talking therapy services over the next 3 years and looked at new onset adverse cardiovascular events. And they found that those people who had recovered from their anxiety and depression in the services had a reduced rate of any adverse cardiovascular event, including heart attacks and strokes. So this is really a very big saving in future healthcare costs. Of course, one reason why people go for psychological treatment as an argument rather than medication is because of the well-demonstrated fact that relapse rates are lower after psychological treatments than medication. So that's another saving in healthcare costs. But if you're a provider who is providing a healthcare service to a large company, which many of you will be doing, there's another bit of the economic argument. And that is that successfully treating anxiety and depression means that your workforce is more focused on the work. One of the big problems with someone who's anxious or depressed is while they're at work, they're often not really present. Their mind is on their worries and their concerns. And so they're less productive in the workplace. And so helping them with their anxiety and depression reduces what technically is called their presenteeism, makes them more effective in the workplace. So that's another big economic benefit to the companies that you're providing healthcare for.